Hi, hello, and welcome to Dr. Ashwinth Dental Info. Today we'll be learning about the cranial nerve nuclei. We all have heard things like general somatic efferent, general somatic afferent, special visceral efferent, etc. But we don't know in depth of what exactly those terms are trying to tell us, and we have not. Most of us would have not have taken an extra step to know that. So this video will help you to clear off those doubts and will make your concepts more stronger. Let us start from the simpler terms, which is afferent and efferent. When you say afferent, it is sensory, and when you say efferent, it is motor. Let me give you a simple example. You have a hot jug and you touch that hot jug. Okay. When you are touching it, the temperature of the jug is sensed by your fingers, by the receptors in your fingers, and the sensation is given to your brain. So it is from the periphery to the center. The center is the brain. Okay. So when a sensation moves from periphery to the center, it is called as a sensory sensation or a afferent sensation. The brain will give off signals to your hand to take your hand off the jug, which is a efferent signal or a motor signal. Motor simply means movement. So we have divided this as general and special. So in general we have 4 components and special we have 3 components. These may differ for different cranial nerves, but as a whole wherever you see GSE it means the same. Okay. So let's start from GSE, which is general somatic efferent. What is this term trying to tell us? So let's focus on the last 2 letters, which is somatic and efferent. So this is a component of a cranial nuclei which is a efferent component. So we have learned efferent is motor of a structure which is somatic in origin. So GSE component is present for motor supply of muscles of somatic origin. Okay, motor supply of muscles of somatic origin. We have 4 cranial nerves which have this component, which is the oculomotor nerve. As we know, the oculomotor nerve supplies the muscles of the eyeball, except SO4 and LR6. SO4 is superior oblique for trochlear for superior oblique, and abducens for lateral rectus, which is the 4th cranial nerve and the 6th cranial nerve. Hypoglossal nerve, as we know, supplies the muscles of tongue. So if you go back to the embryology of the tongue, you can see the muscles of the tongue develop from the occipital somites. So it is somatic. That is the clue. Okay. So which comprises of the GSE component. Then let's move on to GSA, which is general somatic. It's afferent here. Afferent meaning the sensation must go from the periphery to the center. So here we have 2 subdivisions, which is exteroceptive and proprioceptive. Exteroceptive, to be simple, is the sensation from the external surface like touch, pain, temperature, etc. Okay, and proprioceptive is sensations from the muscles of mastication. Exactly what to be precise, any stimulus from external environment. For example, when you are eating and you get a stone inside your mouth, and your teeth will sense it off. So that is an example of a proprioceptive sensation. So GSA focuses on exteroceptive proprioceptive sensations. So GSA is over and GSE is also over. The third thing which comes here is GVE, or general visceral efferent. General visceral efferent is a very important thing because it gives the preganglionic fibers of the ganglions of the head and neck. So we have 4 nucleus which have this component, which is the Edinger-Westphal nucleus, the lacrimatory nucleus, the superior salivatory nucleus, and the inferior salivatory nucleus. As you know, the Edinger-Westphal nucleus is related to the ciliary ganglion and then to the ciliary muscles. The lacrimatory nucleus is present near the salivatory nucleus also, and it is responsible. The lacrimatory nucleus is responsible for the supply of lacrimal, nasal, and pharyngeal glands. And then we have the superior salivatory nucleus and inferior salivatory. Always remember, the parotid is at a higher level, the submandibular is at a lower level. So it is the inverse here. The superior salivatory will supply the salivary gland, which is inferior. So what is inferior? Superior salivatory will supply the submandibular gland, and the inferior salivatory will supply the parotid gland. This is a simple trick to remember because we tend to get confused also. There is also another nucleus called the dorsal nucleus of vagus, but few articles in the recent times have said that this nucleus cannot be grouped under general visceral efferent, and they have modified it. So let's not get into that. And then we have the general visceral afferent. So again, let's focus on the last two terms, which is an afferent sensation of a visceral structure. Visceral means external structure. So you have all the sensations of the viscera. The structures which gets applied are the tonsil, the pharynx, the posterior part of tongue, etc. And these sensations are carried by the glossopharyngeal nerve. And the vagus is also involved, where it takes the sensation from the larynx, the trachea, the esophagus, and the thoracic and abdominal viscera as well. So we are done with the general part. So let's come to the special part. In special part, we have special visceral efferent. Special visceral efferent is also motor. Already we have learned that general somatic efferent is motor, and now we are learning special visceral efferent is also motor. So what makes the difference between these two is that any structure or any muscle which is derived from the branchial arches or pharyngeal arches is supplied by the special visceral efferent component. So here the muscles of mastication are derived from the branchial arches. So obviously it is going to be supplied by the special visceral efferent. And then the nucleus of facial nerve is also a component. So the facial muscles are also involved here. And then we have the nucleus ambiguous also. So the muscles are stylopharyngeus and the muscles of soft palate, the pharynx, the larynx, etc. So the majority of the muscles are supplied by the special visceral efferent. We need to remember the general somatic efferent, the muscles in the general somatic efferent first, so that we can exclude what all comes later. You just need to take your embryology book and you need to sort down your muscles which come from those pharyngeal arches, and then you can easily remember that special visceral efferent is the component that supplies these muscles. Let's go to special visceral efferent, which we all are very familiar, which is taste. Okay, so special visceral afferent is taste, and special somatic afferent is a very peculiar thing, which is hearing. Okay, so we are done with the cranial nerve nuclei, the components of cranial nerve nuclei. To recap, you have the cranial nuclei. We have divided as general and special. We have four components: general somatic efferent, which is the motor supply of the muscles of somatic origin; general somatic afferent, which is divided into exteroceptive and proprioceptive sensations; general visceral efferent, which gives the preganglionic fibers of the peripheral ganglions of the head and neck. We have the general visceral afferent, which takes the afferent sensations from the visceral structures, and this comprises the general. And the special has three things: SVE, SVA, and SSA. Special visceral efferent is the motor supply of all the muscles which are derived from the branchial arch. Special visceral afferent is taste. Special somatic afferent is hearing. Go through this video once or twice, make a note of it, and you can also take a screenshot if you want. I think that I made these concepts somewhat clearer. If you want a more deeper understanding of individual cranial nerves, please do let me know in the comment section. Give me a like if you find this video useful, and also share it with your friends so that they may find it useful as well. And do subscribe my channel to get my recent notifications and recent updates. I also have a page in Instagram, so, where I post a lot of interesting stuff. You can follow me there also. I have provided the link in the description box. Thank you.